I'm going to move on now to our next speaker, there are two speakers, Noelle Desmond and Niall O'Callaghan from Cork County Council. They're going to talk to us about the Embracing the Autumn event that they have run, where dealing with both the older people and teenagers, and particularly in this year, I think bringing some aspect of the impact of COVID-19 on the work that they do with these groups. So I'll hand over, I think, first to Noelle, who's going to start the presentation. Thank you.
Good afternoon, everyone. Thank you very much. Can everybody hear me okay?
We can hear you, Noelle, but we're still seeing Pippa's slides, so I'm just waiting on yours to come through.
Okay, just bear with me one moment and I'll share those with you. Now, how's that? Are we seeing them now?
Just give it a minute there. We're just seeing you now, but we'll just wait 1 minute. I'm not seeing them there. Yeah, they're coming through now. There you go.
Great, super. Super. Good afternoon again, everybody. And look, firstly, thanks for the invitation here this afternoon, and thank you everyone for your time in listening to this and in dealing with positive ageing and social inclusion. I'm presenting in a general sense, I suppose, on social inclusion in the context of policy, and specifically then in looking at older people, positive ageing, and as was mentioned previously, the webinar that we produced recently around Embracing the Autumn and about supporting older people as they move through into the winter time and dealing with COVID-19. As mentioned, my colleague Niall O'Callaghan will come into the later part of the presentation to deal with the Teen Talks, another initiative by Cork County Council. So just moving on to give you a bit of context in relation to social inclusion, and I suppose in local government, social inclusion touches on many different operational areas and service delivery models across local authorities. If we look at policy in particular, places like housing and community development, there's significant policies there that support social inclusion. Looking again at programmes and referencing things like SICAP, significant programmes across local government supporting local or social inclusion. In reality, I suppose we would all agree that many of our operational areas actually provide for socially inclusive design and socially inclusive decision making. So while social inclusion might seem like something that's abstract, in reality it touches on a lot of our operational areas. So looking at the voice of the older person within that context, there's a significant strategy here in Cork County Council that supports age-friendly initiatives and older people across the county, but that strategy really is only as good as its implementation programmes and delivery mechanisms. So in delivering that, we support the Older People's Council to achieve their objectives, working through our Age Friendly Alliance again to support their objectives. One of those initiatives across the county is the Age Friendly Town Network. So that really sees us delivering infrastructural initiatives as well as the support of age-friendly networks across the towns in the county. And I suppose against the back of COVID-19, we would have seen an increased demand to roll out age-friendly initiatives in towns and to double down, I suppose, on our support of older people across the county. The Social Inclusion Community and Rural Development SPC leads out on policy in social inclusion across the county, and again drills down into the needs of older people and positive ageing. Moving away from that then, in terms of more general sense, looking at things like the Council's Community Fund, supporting lots of different groups across the county on an annual basis, but again leaning very much heavily on being socially inclusive and making sure that the needs of older people and the marginalised are provided for. So I suppose for all of us, March 2020 and COVID-19 brought about a massive change to how we do business at local government and to our operational models. This, I suppose, would have impacted not just the wider local authority and its operations, but also our capacity to be inclusive. So just looking at the slide there, what we were hearing, I suppose, from the World Health Organization and from the HSE and in terms of public health guidance, was the need to isolate, to distance And of course that is completely at odds with what we know about social inclusion and trying to involve people. So how can we promote social inclusion when we're actually socially excluding by design? And that was one of the challenges facing us here in the context of our dealings with the Older People's Council and the Age Friendly Alliance. Just looking at what came down, I suppose, at a national level, significant support was delivered nationally in terms of trying to support older people across the county and to make sure that they were included at a time when ultimately they were cocooning or isolating. National initiatives were incredibly efficient, incredibly effective, but again, I suppose there's always a need to adapt to national initiatives to reflect local needs. In Cork, I suppose we like to think that we're a little bit different in Cork at the best of times, and this occasion was no different. So just focusing in on three specific ways, I suppose, in which we adapted those national initiatives. One of those was looking at community support hubs dispersed throughout the county. So recognising the geographic complexity of the county and the size of the county, we established 19 community support hubs throughout the county, working with other stakeholders outside of the local authority to make sure that older people were supported and included in their communities. So moving away from a centralised approach, we moved out into the communities and made sure that the support was near to the people that required it most. Behind that, we designed an automated workflow that matched the needs that were being fed through that community support helpline with the local support services on the ground. So it very much served as a signposting service for people, but with an automated workflow behind it so that we could monitor that from the initial call right through to the need actually being actioned out on the ground in one of the 19 community support hubs. Behind that again was the centralised capture of metrics and key demand areas. So we had oversight at all times of the numbers of calls coming in, and we're able to break down those calls per area and per key demand area. So again, responding, I suppose, to allowing our services to remain inclusive and adapt to needs as they emerged. This slide, I suppose, shows the advocating of the needs for older people. So a lot of what we had seen previously was looking to place responsibility on older people to cocoon, to isolate. And what we were hearing from our Older People's Council was that they felt they had taken on enough responsibility and they wanted other people to take on responsibility. And that this initiative here that you see on screen was born. That was the CARE initiative. So it was really about looking outwards to other people, to other communities, and appealing to them to make sure that older people were included, even though they were physically isolated, just to make sure that they were included where it was possible. So considering the needs of older people, assisting older and vulnerable people, respecting physical distancing and empathising that they might have felt particularly anxious at that particular time. And that, I suppose, that really was the voice of older people permeating right through our service delivery models, and we reacted to that by being in the fortunate position to actually adapt service delivery models to make sure that those needs were actually reflected. So some of the targeted initiatives there that resulted out of the adaptation of service delivery models. One of those, the first one, was the inclusivity of amenity space. I suppose nationally we would have seen initiatives and moves towards some local authorities having segregated times for older people or specific times for older people. And what we were hearing in Cork was that the older people didn't want that. They wanted to be able to go to the park when they wanted. They wanted to be able to shop whenever they wanted. They didn't want to be pinpointed or pigeonholed. So again, we adapted service delivery models and park opening and closing times to provide for that. The housebound library delivery service, another excellent initiative that saw our traditional library service expand out into the community and deliver to those most in need at a time when they would have been most isolated. The conference call facility for older people, a seemingly small initiative, but one that really had a huge impact because it allowed us to stay in contact with the older people in our Older People's Council. We couldn't meet with them physically. They weren't technically enabled, I suppose, to use Zoom or Microsoft Teams, but a simple free-form conference call facility allowed us to keep those meetings going and to keep listening to them and keep incorporating their needs into how we do business here. The CARE campaign we've spoken about on a previous slide, and the age-friendly towns development. So we're now up to 8 age-friendly towns in the county, and while previously they would have had a strong emphasis on infrastructural initiatives for older people, such as dropped curbs and age-friendly parking. We're very much now seeing that the focus is on networks and building resilience among networks of older people in towns. So that's again something that we're adapting to support. Project Act is an initiative, I suppose, that followed on very quickly in March to deal with economies and supporting businesses throughout COVID-19 crisis. And again, Project Act placed older people right at the centre of the decision making there, so that their needs were met throughout. The final example there is the Positive Ageing webinar, and that's the Embracing the Autumn. That's where that particular phrase comes from. And what we did with that was look at a number of key stakeholders, from An Garda Síochána to the HSE to our own fire services, and brought together those people. So we had professional advice and support to older people, and we also had peer-to-peer advice for older people. We brought that together in the context of a webinar within a studio, and that link has now been made available to the HSE, to community hospitals, to nursing homes. We're also looking at broadcasting that on radio so that we can get those key messages out to people again, and I suppose look at different ways that we can connect with older people in the absence of actually being able to meet with them and have traditional conferences, etc. So just to finish up on the lessons learned throughout that, and I think this is applications right across the span of local government services, not just in the context of social inclusion and not just in the context of older people, but putting the voice of the key stakeholders centre stage and actually actively listening to what they have to say and trying to incorporate as much of that into our service delivery and design as possible. The early identification of emerging needs, luckily we were able to do that here and quickly adapt and be agile in terms of how we delivered on the ground afterwards. The leadership role of local government in stakeholder engagement was absolutely key throughout all of this process. We found very willing partners locally in the HSE, An Garda Síochána, and many other stakeholders who were more than willing to allow local government to take that leadership role, put the systems in place, put the process in place, and make sure that nobody was left behind and nobody was left out. Another key point is the peer-to-peer support for older people, and that conference call facility I mentioned, that was integral. Even though it was a simple initiative, it allowed older people to stay in contact with each other in a group setting and to continue their input into local services. Embracing new technologies, but recognising when they're not the answer. And I suppose that again is in reference to the availability of Microsoft Teams and Zoom, etc. Great technologies, but there comes a point as well when we need to change things, and maybe technology isn't always the answer. Building networks for resilience in future crises is, I suppose, one of the key learnings here. This particular learning in terms of reaching out to older people and encouraging positive ageing, and that was built on building networks, and that really, I suppose, has huge implications for how we deal with crises into the future around things like flood events, weather emergencies, so not just COVID-19. And I suppose that's one of the key learnings here, is that in a time of emergency we were able to identify opportunities that we will hopefully continue to work with into the future to look at other service delivery models. Thank you. I'll hand you over to Niall now.
While we're just waiting for Niall to upload his slides there, just to say this is the last chance to put some questions in for the Q&A that will be starting in the next 5 to 10 minutes. So please take advantage of that and put up any queries or comments that you have. Over to you, Niall.
Thank you, Noelle. You can hear me there okay? You can? We
can hear you fine and see your slides.
Great, thank you. And thanks to Noelle for handing over there, and thanks to everybody who's contributed this morning, which has been an excellent event. I'm going to give you a brief overview of an initiative which was organised and coordinated by Cork County Council in association with the Healthy Ireland Fund, and that was our Teen Talk initiative. This event has been running for a couple of years now, and it's just a demonstration, I think, of how local authority work has diversified over the years and how it now addresses the health and well-being of our population. So it started back in 2018, and it's just one event held then, and it had a reach of 600 students. So the event was targeted at transition year students in Cork County and in Cork City as well. So we would have had a number of speakers there speaking about general aspects of health and well-being, but particularly on on mental health. So the real purpose of the events was to promote habits for health and well-being, and particularly mental health amongst transition year students, and to provide an educational and an inspiring and fun event for students as well, promoting a positive mental health and providing an open and safe environment for teenagers to discuss mental health, which would generally be a taboo issue, but we provided a safe environment here, and this was supported by the presence of Pieta House, who provided a counselling service for all of the events on the day as well. And it's very interesting to note that when we did have Pieta House at the events, they were all engaged with a number of students taking advantage of the facility that was available on the day. So in 2019, we expanded the event to 3 events for pretty much the same budget as the previous year. We held events in Charleville, Little Island and Bantry. We had 40 schools attending and up to 1,200 transition year students reached that attended the events as well. Very inspiring and uplifting events which were enjoyed by everybody, both the transition year students and everybody else who had attended. So then in 2020, our plan was to duplicate what we did in 2019 and add on a little more as well, which I will get to later on. But as you can see, the dates that we had planned to hold these events were on the 26th of March, the 31st of March and the 2nd of April. So these were all postponed due to the impact of the COVID-19 and had to be cancelled at quite short notice. So we took the opportunity to move everything online. We were aware of the impact that the impending lockdown was going to be having on, even on mental health of everybody, not just our students because they couldn't attend school, but everybody was facing a very uncertain time. So we decided to expand our content because we knew we were facing a wider audience and that these talks were going to be available to everybody. So we decided to chat with our speakers. We added some new speakers in as well, and we were able to do this because of the more flexible platform that the digital allowed. But all of our speakers then, embraced the whole issue of mental health and well-being for all ages. And I suppose the truth about it being is that a lot of the positive mental health issues affecting our teenagers can go on into future years as well. So we held 8 interviews separately and presentations over the 2 weeks from the 7th to the 17th of April. It was pretty much a presentation and Q&A style recorded interviews, and we had some well-known names throughout the country as well. Grace O'Rourke, Jerry Hussey, Pat Tivoli, Graham McCormack, Elaine Crowley, Jennifer Barry, Aisling Daly and Jacqueline Jeffrey. So they were all very fantastic speakers. They really shared their insights and their knowledge and their experiences as well, which was of great interest to a lot of people. So just in terms of the impact that our events had, it increased it hugely, and I suppose this is something that we didn't anticipate at the beginning, but we went from our first event the first year of 600 students up to 1,200 the following year. But by opening it up online, we had a reach of nearly 40,000 people through the various platforms with at least 5,000 views. And these figures were taken a couple of weeks back. So the fact that these talks are still available on the Cork County Council YouTube channel, they're going to be accessible for everybody, and the information on these, it's not out of date by any means, particularly at the moment, because a lot of these issues are still affecting people quite heavily. So as I mentioned, we adjusted significantly the events. We broadened the topics to make them not just particularly to transition year students, but to all ages, and we added in some more speakers as well, just to diversify the type of speakers that we had. The challenges that we anticipated, I suppose we were keen to get the events out there because people were after entering into the lockdown stage. So we probably, the promotion and targeting of the events was a little bit of a challenge. We advised all of the schools about the events going online, who then would have advised their students. But this is where, because we turned over to the online system so quickly, we probably missed out a little bit here. And it was a time of huge adjustment for everybody, not only for the original intended students, but even those of us in the local authority and those in other employment as well, who were now finding themselves at home. But there are many opportunities that have come from this as well. Another event which we will now be adding on to our Teen Talks events is our Gen Z event. And this was an event that we were going to tag on to the live events. And this is an event not for transition year students, but for the parents of all teenagers. And this would be just tackling the issues and challenges that teenagers would be going through during that time, and these things that maybe adults or their parents mightn't even be aware of. So it's a bit of education and education on how to support their teenagers going through what can be a challenging time as well. So these events will be added on digitally as well. So as well as that, we're going to add on some further digital events, be they recorded, similar to what Noelle described earlier. We can also, start up items like podcasts or audio or other presentations recorded as well. So what it's shown us really is that, the sky is the limit in terms of what we can do in terms of getting the knowledge and the experience out there, and getting that wider reach as well, and having a wider approach to our promotion and targeting the areas of people who are seeking this information, that we can provide this information for them. So that's just a quick snapshot. I hope that's been of benefit to you, and I'll hand back to you, Noelle. Thank you.
Thanks, Niall. That was really interesting. The two sides, I suppose, of the older people and the teenagers, and all of the effort and initiative that's gone into that. It's really, really great to see.